Assalamu alaikum. Today's article is titled Patient-Centered Outcome Assessment of Static and Dynamic Navigation Aided Endodontic Microsurgery. It's a randomized controlled trial conducted by Chen and his group from China and published in JOE in 2025. Endodontic microsurgery is a critical option when non-surgical root canal therapy fails, and although guided endodontic microsurgery using static navigation and dynamic navigation has improved surgical accuracy, to date, no studies have directly compared these two guided approaches with a focus on patient-centered outcome measures within the first post-operative week. This study aimed to address this gap by comprehensively evaluating dynamic and static navigation assisted endodontic microsurgery in terms of postoperative quality of life and analgesic use within the first week. Additionally, it recorded and analyzed differences in intraoperative duration for guided osteotomy and root end resection, providing a nuanced comparison of operation duration and patient impact between the two guided approaches. As for the materials and methods, patients treated consecutively from February 2023 to August 2024 were assessed for eligibility. The inclusion and exclusion criteria are outlined as follows. The inclusion criteria were age between 18 and 69 years and the diagnosis of symptomatic or asymptomatic apical periodontitis in a previously root canal treated teeth. And the exclusion criteria were presence of severe systemic diseases, pregnant or lactating women, second or third molars, and teeth with severe periodontitis, root fractures, perforations, or root resorption. Now moving to the randomization, patients were randomly assigned to two groups, 30 patients each, with an equal allocation ratio. Randomization was performed using the research randomizer program, and to minimize observer bias, a separate operator who was unaware of the randomization details was responsible for recording all outcome measures on the case report form. And for the treatment protocol, the surgeons had been proficient in using both dynamic navigation and static navigation system for more than 2 years. The clinical procedure were divided into three main phases: preoperative procedures, intraoperative procedures, and postoperative procedures. The preoperative procedures, CBCT scanning was performed, and in the static navigation subgroup, CBCT was supplemented with intraoral scans, and a customized thermoplastic 3D guide was printed and trial fitted preoperatively. And in the dynamic navigation subgroup, a thermoplastic device containing 9 or 10 radio-opaque fiducial markers was fitted to the target tooth, customized for different dental arches, and filled with silicone impression material. And the CBCT data were imported into the dynamic navigation planning software to develop a virtual surgical path. And for the intraoperative procedure, the surgery was performed under local anesthesia using 4% articaine hydrochloride with epinephrine, and the full thickness flaps were employed. As for the postoperative procedures, the patients were instructed to not to gargle and to avoid hard, hot, and spicy foods, heavy physical activities, smoking, and toothbrushing on the day of surgery. And the patients were scheduled for suture removal 7 days postoperatively. For the outcome measurements, a questionnaire was used to assess postoperative symptoms and functional impact, and the results were evaluated using a visual analog scale administered within 1 to 7 days postoperatively to systematically assess the patient's quality of life throughout the study. Additionally, patients were required to report whether they had taken any analgesic on each postoperative day, and at the 1 week follow-up, any remaining sutures were removed and the questionnaire results were collected. The duration of the operation was defined as the time taken for the osteotomy and root end resection, measured from the moment the foot pedal was pressed until the burr reached the target depth. Now moving to the results, a total of 60 patients participated and data were collected from 65 teeth and 94 roots. No significant difference were observed between the two groups in terms of age, sex, or tooth position. Only significant difference was observed regarding jaw type. The 1 week postoperative quality of life related to swelling peaked on the second day and gradually decreased over time, whereas other symptoms and functional impacts reached their peak on the first day and subsequently diminished. And no significant differences were observed between the dynamic navigation and static navigation groups in terms of pain, swelling, bleeding, mouth opening, chewing, talking, sleeping, or daily routines. Furthermore, there was no significant difference in analgesic use between the two groups, and the operation duration for the dynamic navigation and static navigation approaches differed significantly. The mean surgical duration for the static navigation group was 121 plus or minus 130 seconds, while for the dynamic navigation group it was 292 plus or minus 180 seconds, showing a statistically significant difference. To conclude this study findings, both static navigation and dynamic navigation are equally effective in terms of patient-reported outcomes during the first postoperative week. However, the static navigation offers a significant advantage in reducing surgery time, making it more efficient in clinical practice, and the choice between the two methods should be based on equipment availability, clinical requirements, and practitioner preference.